Whooping cough cases are on the rise, and May is Lupus Awareness Month. Here with these health headlines and more, Dr. Frita Fisher. So great to see you. Good morning.
Good morning.
So let's dive in. Let's talk about lupus. I was at a walk last weekend for awareness here in the metro Atlanta area. Talk to me about it. What is it and how do you diagnose it? It's kind of tough.
It's very tough. In fact, it takes up to 6 years for the average person to be diagnosed. Lupus is one of those diseases that can imitate many diseases. It's because it can affect any organ, your heart, your lungs, your kidneys. So here's what lupus is. It's an autoimmune disease. So instead of your immune system fighting bacteria, viruses, germs of the outside world, it turns on you. It's a traitor, and your immune system starts to fight your own body. So just like an autobiography is a book you write about yourself, an autoimmune disease is a disease that will attack yourself. And so there are different signs and symptoms: fever, joint pain. There's often a classic rash. We call it a malar rash or butterfly rash, and it occurs right over your nose, over the cheeks. But the thing is, it can cause heart disease, kidney failure, and it mostly affects women. 90% of lupus cases are in women, but men can get it too. In fact, Nick Cannon has shared that he has a diagnosis of lupus. And so it's really important to recognize that when you have all types of symptoms, be it fatigue, joint pain, shortness of breath, and your doctors aren't quite putting it together, it could be hair loss, it could be rashes, ask, please test me for lupus, and so that we can find out if you have it and you can get treated.
What is the age range for it mostly being diagnosed?
Mostly between the ages of 15 and 45. And so we're talking mostly women of childbearing ages. And also it disproportionately affects certain races. Black women, Latina women, Asian women are 2 to 3 times more likely to be diagnosed with lupus when compared to non-Hispanic white women.
No cure for this, but there are treatments.
No cure, but we definitely have treatments, and I've watched them over the decades get better and better and better. And so you really can have a great quality of life, but the key is to be aware of lupus, get tested, and get treated.
Absolutely. Let's talk about breast cancer in the headlines right now due to Beyonce's mom, of course, Ms. Tina Knowles. So what's the deal with this? I mean, it's not just women, it's men too who are at risk.
Absolutely. So of course, mostly women get breast cancer, but 1 out of every 100 cases is in a man. And when it comes to Miss Tina Knowles, Beyonce and Solange's mother, she's been so open about it because she was diagnosed with breast cancer last summer, and she shares that she missed some mammograms. It started with COVID, where she was called because they rescheduled her, and then time got away, and she was diagnosed with breast cancer. Now she's cancer-free, but the important thing to know is that breast cancer is the most commonly diagnosed cancer among women, second to skin cancer. And it's the second leading cause of cancer death. And a lot of women think, oh, you know, I don't have a family history, it's not that big of a deal. But 85% of the women diagnosed with breast cancer have no family history.
And I think, Dr. Frita, what's even scarier too is that many of them have no symptoms.
No symptoms, no symptoms. You don't necessarily get a huge breast lump or some big change. And so that's why it's important to consult with your doctor and to get your screening mammograms regularly.
Okay, let's move on to whooping cough because, I mean, wow, cases are on the rise, and we're not talking about doubling, we're talking about quadrupling.
Absolutely. By some studies, whooping cough cases have quadrupled when you compare them to last year this time. And it's very, very frustrating because whooping cough is an illness that can actually cause death, especially in infants. And at one point, we have brought the numbers down because it's preventable with vaccines. Well, now, with a lot of the misinformation, less children are getting vaccinated. And last year, we had 10 deaths. 6 of them were in babies less than 1 year of age. We've already had deaths this year, and with these cases on the rise, already last year, we had the highest amount of whooping cough cases when you compare them to a decade ago. And here's the issue. It's caused by a bacterium, Bordetella pertussis. And what happens is, at first, you get symptoms like a common cold, a little fever, a little runny nose, but then you get a severe hacking cough, and babies can turn blue. And when they're trying to gasp for air, they get a whoop, you know, and that's why you get the name whooping cough. And so it's something to watch. A lot of older children and adults have no symptoms, and so they hug their sweet little babies and they pass it on. Here's the key. Consult with your child's pediatrician. It's recommended that kids get vaccinated at 2 months, 4 months, 6 months, and then again 15 to 18 months, 4 years to 6 years, and then again ages 11 to 12. If you're an adult and you have not been vaccinated, you just need one vaccine. And very importantly, pregnant women in the third trimester, it's recommended that they get vaccinated for pertussis or whooping cough because it helps to prevent their babies from getting whooping cough and being hospitalized.
I remember that shot. I remember it well. So good to catch up with you, Dr. Frita.
You as well.
Always just so much knowledge, and you can catch up with Dr. Frita on Instagram, Dr. Frita.